This landmark review that's just come out in the UK into gender, medicine and children that makes concrete so many of the concerns the mental health and medical fraternity have expressed for years, despite attempts by activists to shout them down. The review, commissioned by the National Health Service in the UK and conducted by a former president of the Royal College of Paediatrics and Child Health, Dr. Hilary Cass, has rejected the use of puberty blockers for children wanting to change their gender. Now, Cass has even gone as far as to say that the entire field of medicine aimed at children changing their gender was, and I quote, built on shaky foundations. For more, I'm joined now by the journalist at the Gender Clinic News, the wonderful Bernard Lane. Well, we've discussed the lead up to this review on a number of occasions, Bernard, starting, of course, with the closure of the Tavistock Clinic. Just how significant is Cass's review for the practice of gender medicine?
Yes, Peter, I think it's potentially very significant. Her review is relevant internationally. What has happened is that the gender clinics have introduced treatments, puberty blockers, cross-sex hormones, as routine before they had good evidence showing that the benefits outweigh the risks. When you recognise the reality of that situation, that children are being given experimental interventions, what do you do? And this is the question that Hilary Cass is trying to answer. And her solution is to try to normalise this area of gender medicine and try to return it to a mainstream, holistic mental health approach.
I found it extraordinary to see that, you know, as part of her review, she looked into 53 previously published studies on hormone treatments in young people, and all but one study, and she found this, and you know, she's a doctor with paediatric expertise, only one study, she said, looked at the side effects, and the rest of those studies were rated as moderate or low in quality. Now, why is this only being acknowledged now?
Well, that's from a systematic review that was carried out for the Cass inquiry. Systematic review is the gold standard for assessing the quality of evidence said to support a treatment. That systematic review confirms the results of several systematic reviews internationally now. In Finland and Sweden, for example, they have all looked at the evidence for puberty blockers and cross-sex hormones given to kids with gender distress, and they've all independently come to the same conclusion, that the evidence base is very weak and uncertain.
She said in her recommendations too that in most instances a medical pathway wasn't necessary, and that children must be seen as a whole person, not just through the lens of their gender identity. Now, we do that. If a child presents with anorexia, we treat them holistically. We don't tell them that just because they say that they're fat, we look at them and we say, no, you're not. We go down through a whole process of mending the entire person, but we don't do this with gender.
That's right, Peter. The concern is that at the Tavistock Gender Clinic, for example, once a child had raised the issue of gender, then that became the focus. The idea of reform is to try to get clinicians who have a much broader approach and who will not simply take the trans declaration of a child at face value, but will investigate whether there are other issues underlying it. It might be autism, it might be depression, it might be a history of sex abuse or family trauma or difficulty in accepting same-sex attraction. So the idea is to try to get a proper holistic mainstream focus on all the issues that are affecting these kids who come forward saying that their problem is gender.
There's 32 recommendations in the report to overhaul the system in the UK. Now, what stands out as the most significant of these for you? And while I know it's early, but the chances of them getting adopted, given that the UK has really gone hard, Bernard, and not just the UK, there are other Scandinavian countries as well, to wind back this whole gender affirmation push that was really hard and fast for about 10 years. Where do you think the UK is going to go here?
That's very difficult to say, Peter. The Cass report is written in very tactful, careful language because Cass knows that to bring about this reform in therapeutic culture, if you like, she has to carry along many existing clinicians who are committed to the ideological gender-affirming treatment model. So, I mean, it's a horrendous dilemma. Cass recognises that much of the problem is a problem of workforce training. Our universities have become captured by gender-affirming ideology. They are turning out future clinicians who are not going to have the broad focus that Cass says is necessary. One quite striking fact was that the existing adult gender clinics refused to cooperate with the Cass review to give data to try to improve the quality of the evidence for treatments. They refused to cooperate. This is the environment in which Cass is having to try to push towards some kind of reform. She's getting reasonably strong support, it seems, from the Tory government in the UK. But if the next government is a Labor government, that support can't be taken for granted because trans activism and the gender-affirming model appear to have more support among Labor.
Oh, it's the same here. I mean, I've got to ask you the question. I mean, you get a report like this. We've had a House of Lords inquiry in the United Kingdom. We've had the closure of Tavistock. You know, you've got 53 reports, she says, out there, and only one is of moderate, or there's 53 reports out there, 52 of them in terms of medical quality, expert quality, are low to moderate. Only one is worth anything much at all. They've at least had that inquiry, they've had that review, they've looked into the data. We can't even get a parliamentary inquiry up in this country, Bernard. Are we getting closer with this Cass review now in the UK to opening up the door here in Australia to a fair income expert inquiry into what we're doing to our children?
I think, Peter, the recent history of our governments, of our health bureaucracies, our hospitals, our medical organisations, they have all been committed to an uncritical expansion of gender-affirming care, of access to puberty blockers, cross-sex hormones. However, as a kind of a minor theme to that, there's an increasing number of individual politicians, both state and federal, who understand the nature of the problem and who have been pushing for some kind of inquiry. And that will continue. It's interesting that there was a request for a national inquiry from Dr. Philip Morris of the National Association for Practising Psychiatrists, and there was a somewhat encouraging comment from the Federal Shadow Coalition spokeswoman for health. So the question is when a major party in Australia will embrace a policy to have a proper national inquiry into gender clinics, because our gender clinics are giving the puberty blockers as routine treatments, which will no longer be available as routine in England.
You were being polite there, Bernard. What you're saying in simple terms is the Libs have got to get off the fence. They've got to take a position here and they should be on the right side of medical history, expert history, obviously, and children. I'll leave it there. Thank you for your time. Thank you for keeping us right across what's happening in the UK.